Now I'm going to discuss an approach to managing medications with borderline patients, and it is based on the good psychiatric management of borderline patients. And this is where I'll mention the Handbook of Good Psychiatric Management for Borderline Patients, developed by John Gunderson with my participation. And so good psychiatric management does recommend that psychopharmacology has a role to play in caring for borderline patients, and that if you're taking this approach, you're open to using medication. So you may use antipsychotics because they have a value in sort of reducing borderline symptoms. You may use mood stabilizers that can have value for impulsiveness and perhaps for affective instability. Antidepressants, on the other hand, as we've discussed, they'll be usually prescribed for comorbid disorders. One thing we outline is that benzodiazepines have little role to play in treating borderline patients. Of course, they're habit-forming, and borderline patients may have particular difficulty coming off benzodiazepines, and of course, they can be disinhibiting. So the clinical approach we take in good psychiatric management is that psychotherapy is the primary treatment, but drug management can be helpful, and it's meant to be a collaborative process with the patient on choosing the medication and choosing the outcome, particularly outcomes that might relate to functioning. For example, if we can help you with your irritability and impulsivity, maybe it'll be easier for you to participate in that group program. It's important to evaluate symptoms as you start the medication so you can monitor whether there's been a change both in the outcome and in side effects. As we've discussed through this talk, it would be quite appropriate to target a comorbid disorder that's interfering with the patient's functioning. Always try to avoid polypharmacy. So if you're adding a medication, consider whether you can take one away instead of just adding. And one good rule of thumb is it's not a good practice to add a medication during a crisis. Most often, borderline patients have interpersonal crises rather than one that requires medication. And of course, discuss risks versus benefits and monitor the side effects as you move forward with the treatment. So the clinical approach we take in the Handbook of Good Psychiatric Management for Borderline Patients is that psychotherapy is the primary treatment. Good psychiatric management does recommend that psychopharmacology has a role to play in caring for borderline patients. Drug management can be helpful, and it's meant to be a collaborative process that you work with the patient. It's important to evaluate symptoms as you start the medication and monitor the side effects